All right, well, let's do a follow-up first from last week's news because lots of great buzz is happening on this Pennsylvania story. We talked about how Pennsylvania just passed a really important bill that was focused on making insurance carriers in the state of Pennsylvania a lot more accountable for what they promise and also making the information a lot more accessible. I had a comment posted from a young female who stated, "Oh my gosh, that's my bill." And this was like such a geeky moment. And I was like, that's so awesome. I've got to get to know this person, find out her story. So, Abby Zilber, maybe you're out there listening to us. I reached out and I was like, okay, tell me a little bit about how this is your bill, because she's very young and I was super curious how she got involved in the process. All right, so she sent me an email. This is what we got. Her mom is a dentist in Pennsylvania. She's been around dental offices probably her whole life, honestly, as most kids of dentists can attest to. And she's seen how it affects the small businesses and the struggles that she went to. Well, fast forward, she was a part of writing the bill. She was doing an internship with Representative Christine Howard in Pennsylvania, had an opportunity to participate in the writing of the legislation. She is a full-time public policy student at the University of Delaware, but she's still staying involved. And what I loved about this follow-up to our Pennsylvania story is it's going to take all of us, not just dentists, but also people who love dentists. Maybe they're married to them, maybe their parents are dentists, or maybe you just really appreciate and understand the impact we have on oral health and what we're doing for our communities. It's going to take all of us to rally together to write good public policy and good legislation to continue to protect the profession and the patients as best we can. So I love that Abby is coming out as a daughter of a dentist in PA and representing her mother incredibly well. So just a quick follow-up story there. All right, a lot of like famous people in the news as related to dentistry, and this definitely comes in waves. Remember, we had Kanye's titanium grill. Well, we've got a couple other famous people now surfacing into the news that I thought was worth a mention. First was William Shatner, and I just kind of caught a glimpse of his story and dug a little bit deeper, but he had been diagnosed with stage 4 melanoma. And it actually started as a spot, maybe right or left, not sure, behind his ear, kind of presenting more like a swollen lymph node. His first encounter with a physician, they thought it might be a swollen salivary gland. So he did different massaging techniques to try to break that up with the parotid gland there. Unsuccessful, obviously, because at the end of the day, it wasn't that. But the biopsy revealed the melanoma. Then fast forward, yet another famous story comes out. Now, personally, not a story necessarily that I was following until it related to oral cancer, but Gina Kino of the Real Housewives of Orange County also was recently diagnosed with squamous cell carcinoma of the tongue. And she was being seen by her dentist. They thought maybe it was an irritation or frictional lesion of the tongue. Went for a while trying to adjust teeth and do a few things. Eventually, a biopsy revealed that it was squamous cell carcinoma of the tongue. Gina Keogh. Now, I don't bring this up because I want to bring penalty or bastardize the early attempts at diagnosis. What most physicians and clinicians are trying to do is look for the low-lying fruit. What is the most common reason why this thing may present today? And then with appropriate follow-up, if no resolution doing normal activity doesn't make it better, then biopsy is always indicated. Just a friendly reminder, clinicians, if you see something that looks abnormal and there's no other logical explanation for why it may be there, a biopsy is usually indicated. Any changes, a biopsy is indicated. And if it's not resolving within a short period of time or doing the thing that you believe could be related to the issue, it is best to go ahead and biopsy so that you can check off any ill pathology first and then go back to maybe a more likely cause for disease. I wish both of these families well. I hope a good, speedy recovery. I do think they might have a long journey ahead of them as both of these cancers are pretty difficult. Now, I think this parlays quite nicely into our next story coming out of the ADA. And I'm going to be honest with you, there may be a soapbox coming for this one. The ADA wants a council within the ADA is now focusing in on evidence-based antibiotic prescribing. Now, this is based on the fact that from 2012 to 2022, most physicians have decreased the number of antibiotics they're writing, while dentists have maintained a pretty steady percentage at about 10% of all outpatient antibiotic prescriptions being written are coming from dental offices. So it does seem to be shifting a focus on dentists. Now, I think we all know as practicing clinicians, there's a myriad of reasons why we're writing antibiotics. I write antibiotics or have to defer antibiotics for orthopedic things that I don't think need to be prophylactically covered anymore, but yet here we are still having to manage that. We do have pre-medications we have to write for different clinical conditions, heart-related issues, et cetera, and those still do remain. But in the world of CYA, the antibiotic remains supreme. Now, dentists have definitely stepped back on their opioid prescription, which used to be our other alternative opportunity to help manage patients while we were working through a diagnostic process to figure out the origin of the pain. Because it is not always that easy. It is not always clear where the problem is coming from. And when a thing responds to antibiotics, it's often a very interesting piece of information and sometimes can participate in the diagnostic process because we know that that lends itself more towards a bacterial origin of pain. So I want the ADA, this is definitely my own opinion, I want the ADA to be very careful about the messaging that they are about to bring forward if they're going to encourage dentists to reduce their antibiotic prescriptions. And I get it. I'm very restricted in when I write prescriptions and when I think it meets best practices. But it is still a very important part of our toolkit and our armamentarium, even in indications where we are unsure where the pain and the origin story is, because you must be able to ensure to me as a clinician and to Jeff as a key expert witness and clinician that in the event that I don't write the prescription and someone ends up in the ER with a fatal or very life-threatening infection associated with odontogenic origin, that I'm then not going to get sued for following the ADA guidelines, because that's what we're dealing with. That is the, pain medication is one thing. It's an annoyance that we can't give patients pain medications to manage discomfort when it could be indicated because of all the uncertainty around opioid prescriptions. Fine, I get it. No one's probably going to die from pain, but they can die from infection. So let's make sure we're very judicious in this process and that we don't make it impossible for doctors to be able to do their very best in managing patient expectation and helping them get through the diagnostic process. All right, 2 more stories because I know Jeff is chomping at the bit. Okay, I have talked about Delta Dental and I've talked about Aetna. Well, UnitedHealthcare, it's your turn because I don't want to leave anybody out in this conversation. I'm proud of the ADA for at least stepping forward to say that it's time to look at UnitedHealthcare and how they are gathering information about their providers. Most of us as providers have to update our information in the CQH provider portal. All of that information then gets distributed out to the different insurance companies, and they use that. It covers our DEA license, our malpractice information, our MPI, et cetera. All that information is fed on a regular basis through CAQH and distributed out, except UnitedHealthcare. They just want an extra layer of difficulty, and they want to give the providers one more application that they need to fill out in order to be compliant with all of this necessary information. It's ridiculous. So ADA, I hope you're very successful. Standardization for providers in insurance is vitally important for the cost of doing business. And the fact that we have to employ so many people to manage insurance on a daily basis in our office is unsustainable. So even though this seems very small, it is one more administrative task that a doctor is probably either doing themselves when they should be home, doing something much more enjoyable, or paying someone to do on their behalf. Another cost that is keeping us from being more competitive in the landscape and reducing the cost of dental care. So, UnitedHealthcare, you're on notice. And the last victory lap story of the night, Massachusetts, with their big dental loss ratio bill that was passed just a few years ago in 2022. It was a big milestone event for dental loss ratio and kind of the momentum that we've seen since the passing of that. Well, $8.4 million is now being allocated to be sent back to the consumers because those insurance companies failed to meet the state's dental loss ratio standard. This will be the first rebates ever required by the law to be distributed back to the providers and maybe mostly the premium holders or insured. Maybe providers will see something, to be determined. People in Massachusetts, let me know if you get some checks. But we're happy to see the activity. We're happy to see that when you actually pass a law and there is consequence, that those consequences are being distributed out. And with that, that's the news.